Hello everyone, welcome to SOS Classroom, and today we will start the new unit in the anatomy, that is the lungs. So today we'll discuss the anatomy of the lungs. In later videos we will discuss the physiology of the lungs. So let's start the anatomy of the lungs. In the lungs anatomy, there is confusion in the upper respiratory tract and lower respiratory tract. So first of all, we classify the upper respiratory tract and lower respiratory tracts. So first of all, see what are the organs of the respiratory tract. So you can see what are the organs of the respiratory tract. First is the nose, the nasal cavity, pharynx, larynx, trachea, bronchioles, alveolar duct, and alveoli. So these are the mainly organs of the respiratory system. So first of all, we try to classify the upper respiratory tract and lower respiratory tract. Okay, so classification into two parts, that is the upper respiratory tract and lower respiratory tract. URT again divided into three parts. First is the nose, second is pharynx, and third is the larynx. And lower respiratory tract, that is LRT, divided into three, that is trachea, bronchial tree, and lungs. So first of all, discuss the URT, and first part is nose. The nose again divided into three parts, that is nostrils, nasal cavity, and paranasal sinuses. So you can see here, this is nostrils. This part is called nasal cavity, and there are some air-filled cavities also present in the skull bones, that is called the paranasal sinuses, like the frontal sinus in the frontal bone, maxillary sinus in the maxillary bone, sphenoid sinus in the sphenoid bone, and ethmoid sinuses in the ethmoid bone. We will discuss in the later slides. So first of all, discuss the nostrils. So you can see this image. These are the nostrils. There is opening of the orifice of the nose or nasal airway passages. These are the nares or orifice. This is called the nostrils. And each nostrils is separated by a septum. The septum made by the hyaline cartilage. So this is the septum. So each nostrils divided by a septum, that is called hyaline cartilage. And anteriorly it is made by hyaline cartilage, but posteriorly it is made by perpendicular plate of the ethmoid bone and vomer bone. Ethmoid bone and vomer bone, these are the bones of the facial bones you already discussed in the skeletal system. So these are the nostrils. There are two nostrils and one septum in the nostrils areas. Next, second part is the nasal cavity. Nasal cavity divided into two parts, external and internal. So first of all, discuss the external nose. So you can see the structure of the external nose. This is the structure of external nose. What are the parts of the external nose? Nasal bone. Middle part is called septum cartilage. Divided the anterior, divided the lateral portion by the cartilage, that is septal cartilage. Next is the lateral nasal cartilage, middle portion, and lower portion is lower cartilage, also called the alar cartilage. So first is the nasal bone. You can see these are the nasal bone. Nasal bone helpful for the provide the size and shape and support to the upper portion of the nose. Upper lateral cartilage, these are the upper lateral cartilage helpful for the middle part or support to the middle part. Next, lower cartilage also called the alar cartilage. So alar cartilage again divided into two. First is the greater part of the cartilage, that is called greater alar cartilage. And next you can see these are the minor alar cartilage. Next you can see this tissue, it is called alar fibrofatty tissue, or skin and soft tissue cover the nose areas. So these are the part of the external nose. Next is the nasal cavity or internal portion of the nose. You can see the structure of the internal nose. Okay, first start from the nostrils. These are the nostrils. This is also called external nares, and when the nasal cavity open into the nasopharynx, this portion is called internal nares. Internal nares or also called choana. This is external nares or anterior nares. This is posterior nares of opening into the nasopharynx. This area is called the choana. Okay. Next, in the middle portion or in the nasal cavity, there are three projections of the bone. Three bony projections present in the middle portion of the nasal cavity or lateral portion of the nasal cavity. These are the three bony projections, 1, 2, and 3. You can see this is called the turbinate. Turbinate also called the concave. So that's why it's called nasal concave. First, superior turbinate. Second, middle turbinate. And third is the inferior turbinates. So what are the positions? First is the front. Front means anteriorly. So nasal anteriorly, it is called anterior nares or nostrils. Next, back. Back means posteriorly, opening into the nasopharynx. This portion is called the choana or interior nares. Next is the roof. Roof means superior. So superior portion, you can see superior portion made by the claviform plate of the ethmoid bone. You can see this bone is called the ethmoid bone and plate is called the claviform plate of the ethmoid bone. Containing its portion, this portion containing the olfactory nerve for the smelling. So olfactory is the first cranial nerve. There are 12 pairs of the cranial nerves. In the 12 pairs, there is first cranial nerve that is called the olfactory nerve, which will helpful for the smelling of different types of taste, different types of smell. Next is the floor. Floor means the lower portion. Lower portion means inferior. Inferior portion made by the hard palate and soft palate. Hard palate, soft palate made by the maxilla and palatine bone. You can see this portion is hard palate and this is soft palate. This made by the maxilla and palatine bone. Next is the lateral portion. You can see this is the lateral portion. So lateral portion made by the three bony projections, that is called the nasal concave or turbinate. Nasal concave or turbinate is superior, middle and inferior. What are the another structures? You can see these are the air-filled cavity, that is called the sinuses, frontal sinuses. You can see this is the sphenoid sinuses, maxillary sinus in the maxilla bone, and ethmoid sinus in the ethmoid bone. Next, third part is the paranasal sinuses. So already we discussed the paranasal sinuses means what is the meaning of sinuses. Sinuses means air-filled cavities present in the skull bone that is helpful for the produce mucus to clean the air when we are breathing. So air-filled cavities present in the skull bone. There are four skull bone: frontal bone, ethmoid bone, sphenoid bone, and maxillary bones. Frontal sinuses present in the frontal bone. You can see this is the frontal bone and these are the sinuses, frontal sinuses. Ethmoid sinuses present in the ethmoid bone. You can see this is the ethmoid bone and sinuses present in the ethmoid bone. This is the sphenoid sinuses present in the sphenoid bone and this is the maxillary sinuses present in the maxillary bone. So there are four sinuses present in the skull bones. What is the function of sinuses? Sinuses are the air-filled cavities, air filled in this space. That's why the weight of the skull is reduces. And second is the provide the resonance to the sound or in the voice. So these are the functions of the sinuses. Next, what are the functions of the nose? So first function is the respiration, means provide the passageway to entry and exit of the air. Air means oxygen and carbon dioxide. Next function is the filtration. So there are different types of air present in the nose, which will helpful for the trap the dust particles or different types of microbes, and mucus also helpful for the trap the different types of dust and microbes. Humidification and warming. Humidification done by the mucus production done by the mucous membrane, and warming done by the blood supply. Smell by the presence of the olfactory nerve. Olfactory nerve helpful for the smelling. That is the first cranial nerve. Next is the resonance. Resonance done by the different types of sinuses present in the skull bones. Helpful for the voice production. Give the resonance to the sound. Reduce the skull weight and clean the air during the breathing. Next part is the pharynx. So pharynx again divided into three parts. Number one, nasopharynx, just behind the nose. Oropharynx, just behind the oral cavity. And laryngopharynx, just behind the larynx. So you can see. This portion is called nasal cavity. You can see this is bluish portion. You can see nasal cavity. And this portion is called nasopharynx. And this portion is called oropharynx. And this is called laryngopharynx. Laryngopharynx, another name also hypopharynx. So these are the three portions of the pharynx. So first of all, discuss the positions of the pharynx. What is the actual position of the pharynx? So the length of the pharynx is 12 to 14 centimeter. Connection to the nasal cavity or oral cavity to the larynx and esophagus. You can see this is the nasal cavity and this is the oral cavity connected to the larynx and esophagus. What is the position of the pharynx? Superiorly, you can see this is esophagus, this is pharynx, and superiorly is the base of the skull. Base of the skull means the lower portion of the skull. Inferiorly continuous with the esophagus. Anteriorly it's not closing, it's opening into the nasal cavity, nasopharynx, open into the oral cavity, and open into the laryngopharynx, in the larynx. Posteriorly, it's closing by the involuntary muscles, and first to sixth cervical vertebra present behind the pharynx. So the position of the pharynx started from the first cervical vertebra to the sixth cervical vertebra. So first part is the nasopharynx. So you can see nasopharynx present just behind the nasal cavity and just above the soft palate. So you can see this is the nasal cavity, and this yellow portion, you can see this yellow portion is called a nasopharynx. This is naropharynx, this is oropharynx, and this is laryngopharynx. So just behind the nasal cavity, you can see this is nasal cavity, and just behind the nasal cavity, this yellow portion is called a nasopharynx, which is made by the ciliated columnar epithelium tissue. Different types of tissue we already discussed. So this made by the ciliated means present of the cilia, columnar, the cells present in the column shape, rectangular cell, tall cell, and epithelium lining the nasopharynx. In the nasopharynx, there are different types of tonsils present in the nasopharynx. Tonsils means there are different types of lymphoid tissue. And lymphoid tissue destroy the different types of bacteria engulfing or mixing during the swallowing or eating the foods. So you can see there is another structure that is called the Eustachian tube, which comes from the middle part of the ear structures and opening into the nasopharynx. So what are the tonsils present? First is the pharyngeal tonsils. You can see pharyngeal tonsil, also called adenoid tissue. You can see just behind the nasopharynx, this portion You can see this is the pharyngeal tonsil. Next is the tubal tonsil. Tubal tonsil just presents nearby the eustachian tube. That's why it is called the tubal tonsil. Tubal means the tube. Tube is the auditory tube. Auditory tube means eustachian tube. Opening of eustachian tube connect the middle ear to the nasopharynx. So this portion you can see this is called the eustachian tube, comes from the middle ear and open into the nasopharynx. Next, middle part is called the oropharynx. So you can see the nasopharynx present between the just behind the nasal cavity and to the soft palate. And this is opening. This is called tubal tonsil, and opening is called eustachian tube. And around the eustachian tube, the tonsils present tubal tonsils. You can see. First is the pharyngeal tonsil. Pharyngeal tonsil present just behind the nasal cavity, and tubal tonsil also present in the nasopharynx. But in the oropharynx also present palatine tonsil and lingual tonsil. Palatine tonsil you can see this is the palatine tonsils 1 and 2. Two pairs of palatine tonsils, and one is the lingual tonsil. Lingual tonsil present the root of the tongue. You can see this is the anterior portion of the tongue, and this is the posterior portion of the tongue, also called the root of the tongue. This is called the lingual tonsils. And portion of the oropharynx is starting from the soft palate to the epiglottis. So you can see this portion is called the soft palate. Anterior of the mouth is called the hard palate, and posterior of the mouth is called soft palate. And from the soft palate to the epiglottis, the portion is called the oropharynx. And next, third or laryngopharynx, also called the hypopharynx. You can see nasopharynx, oropharynx, and laryngopharynx. So laryngopharynx is starting from the epiglottis to the esophagus. From the epiglottis to the portion of the esophagus. And it is present from the third cervical vertebra to the sixth cervical vertebra. So portion of the pharynx present from the first cervical vertebra to the sixth cervical vertebra. First cervical vertebra to third cervical vertebra present the two pharynx, that is the nasopharynx and oropharynx. And from the fourth, fifth and sixth cervical vertebra, third to sixth cervical vertebra present the pharynx, that is called the laryngopharynx. So you can see laryngopharynx is starting from the epiglottis to the esophagus. So this portion is called the laryngopharynx. Next, what are the functions of the pharynx? So functions of the pharynx is just like a nose. First is the passageway for air and food. Air from the nasopharynx and food from the oropharynx. Warming and humidifying. Warming done by the blood supply and humidifying done by the different types of production of the mucus. And taste done by the nerve ending by the olfactory nerves. And hearing auditory tube, that is called the eustachian tube. And protection done by the different types of lymphoid tissue or lymphoid tonsils present in the nasopharynx or oropharynx, and speech done by the larynx or voice box. Next, third portion is the larynx. So first of all, discuss the positions of the larynx. So you can see this is the glottis portion, and just above the glottis this is supraglottis, and just below the glottis this is subglottis. And top of the most of the larynx is epiglottis. And these are the vocal cord. This is the esophagus and trachea. This is mouth and nasal cavity. So just you can see the yellow portion only. This is called the larynx. So first is glottis, supraglottis, and subglottis, and top most of covering of the larynx portion is called the epiglottis. So larynx is also called a voice box and made by the cartilaginous structures located in the neck. And what is the function? Connection of the pharynx to the trachea. What is the position? Superiorly continuous with the pharynx. You can see superiorly continuous with the pharynx. Inferiorly, you can see inferiorly. This is larynx, and this is inferiorly continue with the trachea. Anteriorly, this is portion is called anteriorly, and these are the muscles of the neck. Anteriorly and posteriorly, you can see third, fourth, fifth, and sixth cervical vertebra. And laterally, there are lobes of the thyroid gland. Because of the in front of the thyroid gland is present in front of the larynx. In front of the larynx, there is thyroid gland, and lobes of the thyroid gland present in the lateral side. Next, structures of the larynx. So, structure of the larynx made by the nine cartilages, where 3 cartilages present in the single and 3 cartilages present in the pair. Non-paired 3 cartilages and paired cartilages 3 cartilages. So first cartilage is single, thyroid cartilage, cricoid cartilage, and epiglottis cartilage. In the pair cartilages, arytenoid in the 2 form, corniculate 2, and cuneiform 2. So there are 6 paired cartilages and only 3 single cartilages. Total 3 single and 3 pair. Total is 9 cartilages present in the larynx. So first you can see what is thyroid cartilage. So this is called the thyroid cartilage. You can see this portion is called the thyroid cartilage. We will discuss in detail. But first you can see what are the 9 cartilages. This is thyroid cartilage. Just below the thyroid cartilage, this is the cricoid cartilage. You can see this is cricoid cartilage. And next is epiglottis cartilage. This is epiglottis cartilages closing the glottis portion. Next, pair cartilages. First is the arytenoid cartilages. So you can see arytenoid cartilages. This is the arytenoid cartilages. Next is the corniculate cartilages. This portion is called corniculate cartilage. This is corniculate cartilages. And third is the cuneiform cartilages. This is cuneiform cartilages. So total 9 cartilages present in the larynx. So first of all, discuss the thyroid cartilage. Okay. So first of all, you can see the structure. This is portion of the larynx, and this is thyroid cartilage. So one lamina, second lamina. So these are the 2 lamina. 2 lamina joined with each other and make a prominent portion. This is laryngeal prominent part. So it is made of the hyaline cartilage. So thyroid cartilage made by the hyaline cartilages. Hyaline cartilages also called a lamina. So there are 2 flat pieces of lamina or hyaline cartilages joined together and form the prominence portion. You can see this part is prominence portion. So prominent part is also called laryngeal prominence or Adam's apple. So this portion is prominent part is called the Adam's apple. Just Adam's apple, you can see the notch. You can see the notch is in V shape. There is no present of the lamina here, and formation of the V shape top of the thyroid cartilage. This V shape is called the thyroid notch. You can see this is the thyroid notch. Next, you can see posteriorly. So posteriorly, this cartilage is incomplete. You can see the anteriorly portion is prominence, that is called laryngeal prominence or Adam's apple. And superiorly, formation of V shape, that is called the thyroid notch. And posteriorly, it is not completely, and formation of 2 folds. You can see this is one fold and second is the another fold. That is called the cornua. Number one, this is inferior cornua and this is superior cornua. This is posterior part and this is anterior portion. So thyroid cartilage incomplete posteriorly and posterior border of each lamina is extended to form the two processes called the superior cornua and inferior cornua. So this is the structure of the thyroid cartilages. So thyroid cartilage is made by the two flat piece of lamina or thyroid hyaline cartilages. Hyaline cartilage, two flat piece joined together and form the prominent part anteriorly. Prominent part anteriorly, that is called the prominence, laryngeal prominence or Adam's apple. Adam's apple, more prominence in the male compared than the female and starting prominence from the puberty of age. So this is the structure of the thyroid cartilage. Next is the cricoid cartilages. So first of all, you can see the structures. This is yellow portion. You can see this is the thyroid cartilage. This is thyroid notch. Already we discussed. Just below the thyroid cartilage, this green portion. You can see this green portion is called the cricoid cartilages. And this is the anteriorly portion. And this is the posteriorly portion. This is called the cricoid cartilages. Okay, so how can you write the cricoid cartilages? So cricoid cartilages present just below the thyroid cartilages, or this is also called the first tracheal ring. This is also called the first tracheal ring. It looks like a signet ring. But the shape of the cricoid cartilage just like a signet ring. And signet ring in front narrow and posterior portion is broad. You can see anterior portion is narrow compared than the posterior portion. This is the cricoid cartilages posterior portion and this is the anterior portion of the cricoid cartilages. The shape of the cricoid cartilages just like a signet ring. Signet ring, anterior part is narrow and posterior part is broad. And broad part attached with the arytenoid cartilage. You can see this is the broad part attached with the arytenoid cartilage. You can see this is the structure just like a bird, just like a parrot. You can see, and you can see another parrot. So these are the parrot shape. You can see these are the arytenoid cartilage. And arytenoid cartilage, this is the cricoid cartilage joined by the articular capsule of cricoarytenoid joints. You can see this is the cricoarytenoid joint. Because of the crico means cricoid cartilage, arytenoid means arytenoid cartilage. That's why this joint is called the cricoarytenoid joint. You can see this is cricoarytenoid joints. So we are discussing the only cricoid cartilages. Okay, so broad part attached with the arytenoid cartilage already discussed, and narrow part continue with the tracheal ring. So narrow part you can see anteriorly, the narrow part continues with the tracheal ring. Next is the epiglottis. Epiglottis cartilage is helpful for closing the trachea during the swallowing of the food. So epiglottis cartilages present in the leaf shape. You can see the leaf shape of the cartilages and is made by the elastic cartilages. Mostly in the larynx or trachea, all are the cartilages made by the hyaline cartilages, but the epiglottis is made by the elastic cartilages. Located just behind the root of the tongue and front of the laryngeal inlet. You can see this is the laryngeal inlet. So just in front of the laryngeal inlet and root of the tongue, the present is epiglottis cartilages, which will helpful for the preventing the or entering the food and liquid to the trachea. You can see this is the prevention of entering of the food and waters into the trachea. So these are the single cartilages or unpaired cartilages. Thyroid cartilages, cricoid cartilages, and epiglottis cartilages present only one. Next is the pair cartilages present in the paired form. First is the arytenoid cartilages. So you can see this is the thyroid cartilage posterior portion, this is the cricoid cartilage posterior portion, and this is the arytenoid cartilages joined by the cricoarytenoid joint. Already we discussed. So they are two roughly pyramid shaped hyaline cartilages. So what are the structures of the arytenoid cartilages? Arytenoid cartilages present in the pyramid shaped hyaline cartilages. Present on the top broad part of the cricoid cartilages, because broad part of the cricoid cartilages posteriorly and narrow cricoid part anteriorly. So this is the broad part of the cricoid cartilages, and just above the cricoid cartilages the present is arytenoid cartilages. They provide the attachment to the vocal cords. So what are the functions of the arytenoid cartilages? Attachment provide with the vocal cord. Next cartilage is the corniculate cartilages. So corniculate cartilages present in the horn-shaped cartilages. Okay, first of all you can see the structures. Again I am repeating. This is the larynx and this is the posteriorly part of the larynx. We are watching this posteriorly. This is the thyroid cartilages called or cornua. This is also cornua, and this is the cricoid cartilages. Cricoid cartilages broad part because of the posteriorly portion. And next this is the arytenoid cartilages, and this arytenoid cartilages we can see here. This arytenoid, this corniculate cartilages, this is the arytenoid cartilages, and this is the corniculate cartilages, and last is the cuneiform cartilages. This cartilage is called arytenoid. And arytenoid, you can see this is the vocal process. Vocal process means from this part it attached with the vocal cord. And this part, this is the muscular process attached with the muscles. Okay, you can see here. This is the posterior part. This is the posterior part attached with the muscles, and anterior part attached with the vocal cord. So that's why it is called vocal process, and posterior portion attached with the muscles. That's why it is called a muscular process. You can see anterior border and posterior border. And just above the arytenoid cartilage, the present is corniculate cartilage. So corniculate cartilage, you can see here, corniculate cartilage sits on the apex of the arytenoid cartilages. So this is arytenoid cartilage, this is the base of the arytenoid cartilage, and this is the apex of the arytenoid cartilages. And on the apex of the arytenoid cartilage, there is present of the cartilage that is called the corniculate cartilage. You can see here, this is arytenoid and this is called corniculate cartilages. And you can see in the corniculate cartilages attachment of the cuneiform cartilages. We will discuss in the next slides. Okay, so corniculate cartilages present in the horn shape and position just above the arytenoid cartilages. What is the function? Function is the opening and closing of the glottis. Okay, third is the cuneiform cartilages. Cuneiform cartilages present in the rod-shaped cartilages. Okay, so we discussed the arytenoid cartilages. This is arytenoid present in the pyramid shape. Corniculate cartilages, this is corniculate present in the horn shape. And cuneiform cartilages, this is cuneiform cartilages present in the rod shape. So cuneiform cartilages situated anteriorly and lateral to the corniculate cartilages. So this is corniculate cartilages. So against the lateral or anteriorly of the corniculate cartilages present is cuneiform cartilages. What is the function of cuneiform cartilage? Help and support the epiglottic fold. So this is the functions of the cuneiform cartilages. So what are the functions of the larynx? First function is passageway for air, entry of the oxygen and exit of the carbon dioxide. Next function is warming done by the blood supply, humidifying done by the mucus production and filtering done by the cilia, different types of cilia and mucus productions. Production of lower respiratory tract, production by the epiglottis to entry of water and food particles entry into the trachea, and production of sounds and by the voice box or different types of vocal cords and helpful for the speech. So these are the main functions of the larynx. So we discussed the upper respiratory tract. And next we start the lower respiratory tract. In the lower respiratory tract, what are the organs comes in the trachea, bronchi, different types of bronchioles, and lungs, bronchial tree we discussed in this LRT. So first of all, discuss the trachea or windpipe, because esophagus also called a food pipe and trachea also called a windpipe. Okay. So first of all, see the structures, because the structure is very complicated. First of all, you can see this structure. What is the meaning of this structures? S for superior, I for inferior, L for lateral, R for right lateral and left lateral. This is superior and this is inferior. So this is the structures. This is the superior, this is inferior, this is right lateral and left lateral. So what are the structures? You can see this is laryngopharynx, this is thyroid cartilage, this is cricoid cartilages, this is thyroid gland. You can see yellow portion, this is thyroid gland, this is trachea, and this is aorta of the heart, and this is again trachea, and trachea divided into right and left bronchi. Okay, see the structures of the trachea. So trachea is the cartilaginous membrane and tube that serve as the airway connecting to the larynx to the bronchi. So trachea helpful for the connection of the larynx to the bronchi. What are the locations? So cricoid cartilage, it is present from the cricoid cartilages. Cricoid cartilages present at the level of the sixth cervical vertebra. Cervical vertebra 6 to the T4 or T5 level. T4 or T5 level means the thyroid cartilage, thyroid vertebra 4th or thyroid vertebra 5th level. The present is carina. You can see the trachea divided into two portions of bifurcation into right and left. This part is called the carina. So this is the structures of the trachea. What is the length of the trachea? Approximately 10 to 12 centimeter long in the adults. What is the diameter? Approximately 2.2 to 2.5 centimeter in diameter. How many cartilages present in the trachea? 16 to 20 C-shaped hyaline cartilages ring, anteriorly closed but posteriorly open. Posteriorly completed or closing done by the trachealis muscles and fibroelastic tissue. Okay, you can see the layers of the trachea. You can see this is the esophagus, also called a food pipe, and this is called the windpipe or trachea. So this is the structure of the trachea and this is the structure of the esophagus or food pipe. First of all, see the trachea. There are 4 layers present in the trachea. From the inner side, this is the mucosa. This is called respiratory mucosa. Inner layer is called the respiratory mucosa. Respiratory mucosa are lined by the pseudostratified columnar epithelium and also present of the goblet cells, and goblet cells release the mucus which will help for the airs or different types of trapping the bacteria and dust particles during the inspiration and expiration. Next layer is the submucosa. Submucosa contain the glands and connective tissue. Second layer is the submucosa. And third layer is the cartilages. There are C-shaped cartilages. You can see this is the C-shaped cartilages made by the hyaline cartilages. And posteriorly, you can see this posteriorly don't have a cartilages, and this made by the closing done by the trachealis muscles. You can see this is the trachealis muscles. And last layer is the adventitia. You can see last layer is closing done by the adventitia. So there are 4 layers present in the trachea. Number 1 from the inside to outside. Number 1 respiratory mucosa. Second is the submucosa. Third is the hyaline cartilages. And fourth is the adventitia. Same like in the esophagus also have 4 layers. Inner side is the mucosal layer. Second is the submucosal layer. And third layer is the muscular layer. And fourth is the adventitia or serosa. We will discuss in the GI system. Next, what is the positions of the trachea or windpipe? What is the exact position or locations of the windpipe? Okay, superiorly. What is the superiorly to the trachea? That is the larynx. You can see just above the trachea, the portion is called the larynx. Inferiorly you can see the right and left bronchus or carina. Inferiorly divided into 2 or bifurcation into 2, right and left. Anteriorly means just front of the trachea. This is the thyroid glands. Next is the sternum. And large blood vessels. Large blood vessels means aorta and subclavian arteries. So these are the large blood vessels in front of the trachea. Posteriorly present the esophagus, and laterally the lungs, right lungs and left lungs, and lobes of the thyroid glands. You can see the laterally right lobe of the thyroid glands and left lobe of the thyroid glands. So these are the positions of the trachea. Superiorly larynx, inferiorly right and left bronchi, anteriorly thyroid glands, anteriorly aorta and sternum, and posteriorly esophagus, and laterally lobes of the thyroid glands. What are the functions of the windpipe, or what is the function of the trachea? So first function is the C-shaped cartilages. C-shaped cartilages helpful for the support and patency of the trachea and prevent from any obstruction during the swallowing of the food particle in the esophagus. You can see when you are swallowing, then you cannot take the respiration during the swallowing because of the opening of the esophagus and closing of the trachea. Next is the mucociliary escalator. Mucociliary escalator means the mucus and cilia trap the dust particles and different types of foreign particles and microbes and send to the upward with the presence of the cilia and movement of the cilia with the help of the mucus. Next is the cuff reflex. Because of the nerve ending in the trachea, larynx and bronchi are sensitive to the irritations. You can see when any foreign particles enter into the trachea, and by the help of the nerve endings, there is irritations present in the trachea and formation of the cuffing. It's done by the vagus nerve endings. Next function is the warming, humidifying and filtering. Again, same by the warming, blood supply, humidifying by the mucous membrane, mucus production, and filtering done by the different types of cilia present. Next and fifth part is the bronchial tree of the lower respiratory tract. Okay, first of all, see the structure, then we discuss the theoretical portion. First of all, you can see this is the larynx. Next, you can see this is the trachea. And next structure very complicated. Okay, see the complicated structures. First, trachea divided into right, divided into left. This is called bronchus. Left main bronchus and right main bronchus. So what is the bronchi? So one bronchus and second bronchus. This is the plural. Plural is called a bronchi and singular is called a bronchus. So trachea divided into right and left. This is called the bronchus. Okay, bronchial tube divide into three main parts. First part is the main bronchi, second part is lower bronchi, and third part is segmental bronchi. So what is the meaning of main, lower, and segmental? Main portion or main bronchi not entry into the lungs. This is the portion of the bronchi outside the lungs. That is called the main bronchi. So you can see main bronchi. This is main bronchi to the right side and main bronchus to the left sides. Next, secondary or lower bronchi. Lower bronchi, why it is called lower? Because this bronchi present inside the lungs, or you can see that this portion of the bronchi enter into the lungs. That's why it is called the lower bronchi or lobe bronchi. Next is the tertiary or segmental bronchi. Segmental bronchi means lower bronchi divided into different type of segments. That's why it is called the segmental bronchi. Again, segmental bronchi divided into subdivision into subsegmental bronchi. So first of all, you can see main bronchi. So this is trachea divided into right and left bronchus. This is called main bronchi. Right main bronchus and left main bronchus. Next, secondary lower bronchi. Lower bronchi means the bronchi present in the lobes. You can see this yellow structures 1, 2, and 3. So this is the 3 lower bronchi enter into the lobes. First enter into the first lobe, second into the second lobe, and third enter into the third lobe of the lungs. That's why to the right side of the lung have 3 lobes of the lungs, and left side there is 1 and 2. So only 2 lobes present on the left sides. Next, you can see tertiary segmental bronchi. So you can see these are the light green portion. You can see 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So these are the 10 segmental, approximately 10 segmental bronchi present to the right side, and you can see left side 1, 2, 3, 4, 5, 6, 7. So 7 to 8 segmental bronchi present to the left sides. So first of all, discuss the main bronchi. Okay, so you can see main bronchi. This is the main bronchi formed by the bifurcation of the trachea at the carina. Bifurcation means division of the trachea into the two portions by the place of carina. So this is the bifurcation of the trachea at the level of T4 or T5, because the length of the trachea starting from the C6 to the T4 or T5 level. T4, T5 means thoracic 4 to thoracic 5 level. Next is the right bronchus and left bronchus. So what are the differentiation between right and left? You can see this is the right and this is the left. Right bronchus is wider, shorter, more vertical, and more prone to the foreign body injury. Why? Because of it is more vertical. So more vertical, it is helpful for the foreign body to entry into this right bronchus. And length of the right bronchus is 2.5 centimeter long. This is the 2.5 centimeter long. And left primary bronchus just opposite of the right bronchus. Right bronchi is wider and left bronchus is narrow. Right bronchus is shorter, left is longer. Right is more vertical, it is more horizontal. You can see this is the more horizontal in shape due to the heart position, because of the heart position present on the left side. And length of the left bronchus is 5 centimeter long. So right bronchus length is 2.5 centimeter long and left bronchus is 5 centimeter long. Next is the secondary or lower bronchi. So secondary or lower bronchi, the bronchi present in the lobes. So right lung has 3 lobes and left lung has 2 lobes. You can see superior, middle and inferior. But to the left sides only 2, that is the superior and inferior. There is no of the middle bronchi. Next is the tertiary or segmental bronchi. Segmental bronchi, you can see the light green color. You can see 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So these are mainly 9 to 10 segments present in the segmental bronchi to the right side. And the left side approximately 7 to 8. You can see 1, 2, 3, 4, 5, 6 and 7. So 7 to 8 segments present to the left sides. Next, smaller bronchi and bronchioles also present. So there is 2 portions, that is the conducting zone and respiratory zone. So conducting zone is starting from the trachea, bronchi, bronchioles and terminal bronchioles. Terminal bronchioles is the end of the conducting zone. And respiratory zone have respiratory bronchioles, alveolar duct and alveolar sac or alveoli. So when it is called the bronchiole, so bronchiole, the branches less than 1 mm in diameter. When the diameter of the bronchioles is 1 mm or less than 1 mm, that is called the bronchioles. Next is the terminal bronchioles. So terminal bronchioles is the last part of the conducting zone. You can see this is the conducting zone and terminal bronchioles is the last portion of the conducting zone. And next is the respiratory bronchioles. So respiratory bronchioles begin with the respiratory zone and till the alveolar sac, which have a budding of the alveoli or attachment of the different types of alveoli. Next, the alveolar duct and alveolar sac. So you can see alveolar duct where it is different types of alveoli attached. So alveolar duct is an anatomical passageway in the lungs that is connect the respiratory bronchioles to the alveolar sac. You can see the duct is helpful for the attachment of the alveoli. An alveolar sac are cluster of the tiny air sacs or alveoli at the end of the respiratory tree where the gas exchange occurs. You can see different types of arteries and veins attachment surrounding to the alveoli and there is exchange of the gases. That is called the external respirations. Next is the functions of the bronchial tree. So what is the function of the bronchial tree? First is the provide pathway for air from the trachea to the alveoli, divide air evenly between lobes, lungs and segments, filter warming and humidifying air and allow gas exchange at the alveolar level. Okay, so you can see the bronchial tree during the bronchoscopy. You can see these are the bronchi, bronchial tree. From the insides, you can see this is our bronchial tree. Okay, next and last we'll discuss the lungs. So to clearly identify the anatomy of the lungs, we have 6 points. Number 1, general features of the lungs, lobes and features of the lungs, hilum of the lungs, bronchial tree, blood supply to the lungs and pleura. So first of all, discuss the meaning of the lungs. So you can see lungs are essential organ for the respirations. We already know they're located in the thoracic cavity, either on the right side and left sides. Space is called the mediastinum and mediastinum in the place is present of the heart. They are in cone shape. You can see these are the concept in structures. So what are the general features of the lungs? In the general features, there is apex, base, different types of surfaces, and different types of borders. So in this image, you can see the apex. You can see the apex or topmost part of the lungs, and base is the lower portion of the lungs. You can see this is the base of the lungs. You can see this is the base of the lung, and this is the apex of the lung. So apex part, you can see this is the present in the rounded shape. You can see this portion is in rounded shape and extends slightly above the clavicle. The portion of the clavicle and slightly above the clavicle is apex portion of the lungs. And base, you can see base part is not rounded. Base part is broad part and in concave in shape. You can see the shape of the base part is concave in shape and rest on the diaphragm, because just below the base part the structure is present, or muscular structure is present is diaphragm. Next is the surfaces of the what are the surfaces of the lungs? You can see costal surface, mediastinal surface, and diaphragmatic surface. There are three surfaces. So first of all, you can see costal surface. So costal surface present in convex shape, lie against the costal cartilage, against the ribs and intercostal muscles. So this area of the lungs toward the rib side, toward the intercostal muscles, toward the costal cartilages. So this is the costal surface. So these all lung surfaces toward the costal cartilages, toward the ribs or intercostal muscles. Second is the mediastinal surface. Mediastinal surface means the concave shape and faces heart and mediastinum spaces. You can see mediastinal surface. So here is heart is present. So this is called the mediastinal surfaces. This is the mediastinal surfaces. Next is the diaphragmatic surfaces. Diaphragmatic means toward the diaphragm. So it is present in concave shape. You can see this portion is called concave shape and diaphragmatic surface rest on the diaphragm. So there are three surfaces. First is the costal surfaces toward the costal cartilage, toward the rib side, toward the intercostal muscles. Mediastinal surfaces toward the mediastinum spaces or toward the heart present in the concave shape. And diaphragmatic surfaces toward the diaphragm present in the concave shape and rest on the diaphragm. Next is the border. So there are three borders: anterior border, posterior border and inferior border of the lungs. Anterior border, you can see anterior border. This is the anterior border. This is the thin near the sternum. This is the anterior border. You can see this is the anterior border. Posterior border, it is thick and near the vertebral column. You can see this is the posterior border. It is thick compared than the anterior border. This is thick and near the vertebral column. And last is the inferior border. You can see this is the also thin and inferior border toward the base of the surfaces of the lungs. There are three borders: anterior border toward the sternum side, posterior border toward the vertebral column, and inferior border toward the diaphragm or base of the lungs. Next is the lobes of the lungs. So there are three lobes present to the right side and two lobes present to the left side. In the right side, upper lobe, middle lobe and lower lobe, that is superior, middle and inferior. But only two lobes, upper lobes and lower lobe, that is superior lobe or inferior lobe to the left sides. The left lung is smaller due to heart positions, because this left lung is smaller compared than the right lung because of heart is present to the left sides. Next is the fissures of the lungs. So what are the meaning of the fissures? Fissures means the deep groove or cleft formed by the double fold of visceral pleura. How to double fold of the visceral pleura? You can see. This is the superior lobe, this is middle lobe, and this is inferior lobe. So covering of the serous membrane done by the visceral membrane. So superior lobe also have a visceral membrane and middle lobe also have a visceral membrane. So middle lobe, superior lobe connection here, that's why it is two fold of the visceral membrane. One fold from the superior lobe and second fold by the middle lobe. It is called the horizontal fissures. So right lung has a two fissures. You can see first fissure and second fissure. This is called the horizontal fissures. You can see this is the horizontal fissures. And second is the oblique fissures. You can see oblique fissures. So horizontal fissures present between the superior lobe and middle lobe to the right lungs. And oblique fissures present between the middle lobe and inferior lobe to the right side. But there is no horizontal fissure to the left side. You can see to the left side there is no horizontal fissures because of two lobes only. So it has only one fissure, that is the oblique fissures. So oblique fissure present between the superior lobe and inferior lobe to the left side and absence of the horizontal fissures to the left sides. So right lung separated by the oblique and horizontal fissures and left lung separated by the oblique fissures, and also has a cardiac notch and lingula. You can see this is the cardiac notch. This space is called the cardiac notch. Here is the heart is present and this notch is present. This is the inferior part of the superior lobe present in the notch C. This is called the lingula. Next is the hilum of the lungs. So what is the meaning of the hilum? Hilum means the entry and exit of the different types of vessels and structures. So you can see this is the hilum of the lung. So what are the structures entry and exit from this hilum? There is a bronchi, entry of the bronchi, entry of the pulmonary arteries, exit of the pulmonary veins, and entry of the nerve and lymphatic vessels. So you can see these are the structures of the hilum. There are right pulmonary artery, oblique fissures, right bronchial artery, right superior pulmonary veins, intermediate bronchus, bronchopulmonary lymph nodes, right inferior pulmonary veins. So these are the different structures entry into the lungs, and some structures exit from the lungs. This portion is called the hilum. Next is the bronchial tree. So bronchial tree is starting from the trachea. Next, trachea connection with the main bronchi connection with the lower bronchi, lower bronchi connected with the segmental bronchi. Again, segmental bronchi subdivided into subsegmental bronchi, then smaller bronchioles, then terminal bronchioles. So from the trachea to the terminal bronchiole, the portion is called a conducting zone. Conducting zone means there is only conduction of the air entry and out, but there is no absorption, there is no exchange of gases between this place. This place only helpful for the entry and exit of the air. From the trachea to the terminal bronchiole, the portion is called the conducting zone. But respiratory zone, that is the respiratory bronchioles, alveolar duct and alveoli. So respiratory bronchioles and alveolar duct also have some exchange of gases. Exchange of gases means there is exchange of the CO2 and oxygen, and alveoli have 100% exchange of gases, that is oxygen and carbon dioxide. So alveoli, alveolar duct and respiratory bronchioles comes under the respiratory zone. Respiratory zone means exchange of gases take place, but conducting zone, there is no exchange of gases take place, but there is conducting zone only helpful for the transfer or a transfer of oxygen and carbon dioxide from the outside to the inside and inside to the outside of environment. Next is the blood supply to the lungs. So blood supply to the lungs is done by the pulmonary artery and pulmonary veins. So pulmonary artery, you can see the heart structure. So pulmonary artery receive the blood from the right atrium, from the left ventricle, right ventricle, you can see. Pulmonary artery deoxygenated blood from the right ventricle to the lungs. So you can see this is the right ventricle, supply the blood to the lungs with the help of the pulmonary arteries, and oxygenated blood from the lungs to the left atrium. So these are the blood supply. But supply to the lungs, that is called the bronchial circulation. Same like a heart, then done by the coronary circulation. Same, the circulation to the lung tissue done by the bronchial circulation. Supply the nutrition and blood to the lung tissue done by the bronchial circulations. Next and last is the pleura. So pleura is the serous membrane. Serous membrane present in the lungs, that is called the pleura. And it has two layers. First is the visceral layer, that is called visceral pleura, and second is the parietal pleura. So you can see structures. This is the right lung, this is the left lung, and this portion you can see here. This is the ribs. This is outer layer. This is called parietal pleura. So parietal membrane of parietal pleura directly attachment to the wall of the ribs or chest wall, and inner is a visceral pleura, directly attachment to the lungs, lining to the thoracic cavities, costal space. You can see outer, directly attachment of the chest wall, and inner, that is visceral pleura, directly attachment to the lungs. And between them, there is a space. This is called the pleural cavity. And in the pleural cavity, there is fluid is present, that is called the pleural fluid. An amount of the pleural fluid is 10 to 20 ml approximately, which will helpful for the lubrication and reduce the friction during the breathing. During the breathing means during the inspiration and expiration of the lungs. There may be chances of the friction, there may be chances of the injury during the inspiration and expiration of breathing. So prevent from the injury to the lungs, there is fluid is present, that is called the pleural fluid or serous fluid, that is approximately 10 to 20 ml, which will help you for the prevent from the injury to the lungs. So this is all about the anatomy of the lungs. I hope you understand. If you have any doubt related to the anatomy of the lungs, different types of structures, you can comment me. Next video on next lecture, we will discuss the physiology of the lungs, how the functions of the lungs, how the functions of the diaphragm, how the intercostal muscles work. We all in detail discuss in the next lecture. Till then, thank you so much, and thank you for watching this video. Thank you so much.